This is the Changed Physician, episode 195. This is actually part 2 from episode 194 with Paul Thomas. Enjoy.
I'm a great ranter. I'm very good at it, but I'm not very good on action. And this is one of the things with this discussion that we're having today that I honestly see a place for everybody who's complaining about all the stuff that we have, the white coats, the blurred things, not knowing who's who, being called, a female doctor being called a nurse when they're a physician, this idea of dressing professionally, it just seems like a way that we, instead of ranting, can actually take control. And I love the words, what you said about controlling the narrative. So in your own practice, have you done anything to sort of establish this narrative or to maintain this consistent narrative for your patients and provide an example?
Yeah, I think really simply, the images that we have on our website, the images that we share about our practice on social media, you'll often see us wearing white coats or otherwise professional attire. I'm always wearing, button front shirt, slacks, leather shoes. I wear a nice watch, and I keep, I keep myself upright. I smile broadly when I greet my patients. I look people in the eye. I think these are the little things that can help us create trusting relationships with our patients, welcoming practice environments. And so you'll see it across our brand for the way we convey ourselves. You'll see those images of us dressing professionally and greeting our patients with a smile, not only on our website, but across our social media. And then when you come into our office, it's going to feel consistent because you're going to see the same doctors looking the same way, greeting people with that warm demeanor. And I think that's what we're trying to project in our practice. And I think a great way kind of to pivot this conversation to teach that is to really respect that interview process. I mean, medical schools are setting a standard. When people walk into their door, you want your professors, the people interviewing, to reflect the culture of your institution. And I think for medical students, it's a great opportunity to demonstrate that you're mature and confident. These are two words that I use for aspiring pre-meds and medical students who want to go into residency. You want to present yourself as mature and confident so that you look like you belong, so that you feel like you belong when you walk into these medical institutions, medical schools that are oftentimes traditional. And so in the second chapter of my book, I go to great length to describe what a great medical school interview looks like, from when you step foot on campus, the way you call the receptionist at the medical school, to what to wear when you walk on campus, a jacket or a coat over your suit, bring an umbrella in case it rains, those sort of things, how to hold your water bottle. Oftentimes they're going to pass you a water bottle and you don't want to be carrying this around to everything, kind of like fumbling with all of your belongings. To, when you sit down with your interviewer, you don't really want to sit in a swivel chair because you're going to be swiveling back and forth. To after the interview, sending a thank you note and just letting that person know that you're grateful for the time that they spent with you. These are the little things that we can do when we enter the profession that kind of sets the tone for our life, our professional life in medicine.
I'm curious, this whole teaching thing in your own office, do you interview people and tend to pick the kind of people that do these things already? Or do you train them with what you're teaching in this book?
Yeah, for the doctors that I work with in my clinic. Yeah, so one of the ways that I do it is, like, I've interviewed a lot of doctors who wanted to join us, and I pick people for a lot of reasons, and professionalism is one of those reasons. I want people that look and feel like physicians, like model physicians, the type of people that I would trust with my own healthcare. And so I'm so grateful to be working with Dr. Orlick, Dr. Raquel Orlick, and Dr. Leslie Rabeau. They always come with their A game to the clinic. They're prepared. They're meticulous about their patient care, and it's just a pleasure to work with them. And they look the part. They look like the physician that you would want to trust with your most important healthcare needs. And then the other thing is like a simple thing is, on days where you don't necessarily want to wear the white coat, we have like scrub jackets with our branding on it. It has the Plum Health logo and the physician's name on the other side. So they're easily identifiable as somebody who works at Plum Health, and it has their name and their title right there. And so if you want to say, okay, this is my, Dr. Rabeau, this is how you spell it, it's right there on the front of their jacket. It just makes it very easy so that you can be comfortable in like a scrub jacket or a white coat in the office.
Right. And so as an example for those out there listening, maybe medical students or someone in practice, without saying names, is there any particular characteristics of someone you interviewed that turned you off by how they presented themselves?
Yeah, I can give you a ton of examples. I think this is a really easy question. And I think this is something that medical students should listen to, and residents or, residents who are applying for fellowship, medical students who are applying for residency. You want to buy a suit or have a suit that you feel comfortable in. You don't want to wear the suit for the very first time to your interview. Same with a shirt. When you have a brand new shirt, it's got those creases in it from where it's been folded and put in that plastic packaging. You want to bring that out. You want to wear it once or twice. You want to have it dry cleaned before you go to the interview. Remove the dry cleaning tags before you go to the interview. Sounds like a no-brainer, but maybe this is the first time you ever had something dry cleaned. You remove those yellow or blue tags from your garment so it looks like you're mature and confident. It's not the first time you've worn a suit. The other thing, somebody might buy a new suit, and on the sleeve of the suit, like on the arm here, right forearm, there's typically a white tag that says like Calvin Klein or Hugo Boss or whatever. That is not supposed to be there after you wear it. Once you purchase it, you remove those. Similarly, on the pockets, sometimes suits are sold with tailor's tacks, like big white basting threads. They keep the pockets closed, okay? So that when somebody tries it on at the store, let's say Nordstrom's, they don't stuff gum or wrappers in there. It keeps the garment clean. And sometimes they'll be on the shoulder to keep the structure of the jacket intact. You want to remove these white basting threads before you walk into your interview. If you wear a tie, great. Tie the tie all the way up. Make sure it's knotted correctly. Don't loosen it. Don't have it like half on, half off. If you don't wear a tie, that's great too. Things are loosening up in our society. Things are a little bit less formal now in 2022, especially after this pandemic. Maybe you don't necessarily need to wear a tie. I strongly recommend it for male medical students. And then when you're wearing a suit, wear leather shoes. Don't wear tennis shoes. Don't wear open-toed shoes. Wear a nice solid leather brogue shoe. And if you do that, you're going to look great. Bonus points if you have like a nice blue or gray suit. Try to avoid black or white or green or brown. I think keeping it fresh with a blue or gray suit is a really good look. And smile. Another thing that I've seen a lot is some people come in with hair covering their face. And that's not great because we want to see you as somebody evaluating you. We want to see how you react to questions, and we want to be able to see your face. If you have long hair and you can sit through an interview without twirling it or whisking it unnecessarily, great. You can keep your hair down. If you can't, bring it back into a ponytail or a man bun, whatever you want to call it. That's fine. Just keep it away from your face. Don't play with it. Again, jewelry. Wear a wedding ring if you have one. If you're married, wear a watch is nice. If you wear a lot of jewelry, just make sure that it's not too dangly or too distracting. What I mean is like if you have 4 like wrist bangles and they're like moving every time you're talking with your hands, it's going to be distracting. And likewise, if you have larger earrings and you're shaking your head all the time and they're rattling and making a lot of noise, that's going to be distracting for an interviewer. So these are some simple things you can do. This is not the exhaustive list. The exhaustive list is in the book, but these are simple things that just can help you connect with your interviewer. And now in the time of Zoom, I put a whole section on like how to set up your computer with a nice light source so that you're looking directly at the camera. Because if you're like looking down at the camera, it's going to make you look funny. And if you're looking up at it, maybe you're looking like a little kid filling in for an adult. You want to look mature and confident, and that can come across in your tech setup. So that's all in there. I
Yeah.
can go on for a longer time, but I'll cut it there.
Yeah, I was gonna just say that I have medical students or pre-med people that shadow me that actually watch, or listen to our podcast. And I have to say, if they're listening right now, which I'm sure someone will, I think your book is, I think there's so much desire I just had an hour and a half conversation with someone about what to put in their, letter or their essay, and what to think about to be prepared for like interview and whatnot. I think they're really a prime audience for, they're worried about how they're going to be accepted into medical school or how they're going to be perceived, and they want to make sure they capture every opportunity to like be successful in that initial stage to get into this profession. So I think it's such a great audience to be really eating up all the details in your book, for sure. I mean, obviously beyond medical school too important, especially for some people, but I do know there's some people, my colleagues in the profession, that they might think they got it all right already. So, they may not seek out things, but man, what a great audience too, to just start off on the right foot, so to speak, at the very beginning and get it right early on. But anyway, Kevin.
Oh no, Paul, you look like you want to say something there.
Yeah, I mean, this is one of the big reasons why I wrote it.
Good.
That opportunity to be a chief resident and to interview our incoming interns was eye-opening, seeing how different people present themselves. And you might have a great candidate who just looked disinterested because their suit was wrinkled, or they just didn't look like they tried to put themselves together. Like, was this the last program that you interviewed at and you're just doing it just to do it? Like, don't come and take up a spot by somebody who's going to be excited, who's going to be fresh and put their best foot forward. So, this is a huge reason why I wrote this, for these incoming medical students, pre-meds, and then medical students going to residency. This is a really big opportunity for you to set yourself apart and demonstrate that you're mature and confident.
Yeah. And so, go ahead.
Yeah, I was going to say, and there's a point about that too, because I'm trying to listen to this as the critic as well. And so it was, people, how my dressing and my style is part of who I am, and they need to know this so that this is who I am, and I'm coming in and I'm being real or whatever, and I guess what I'm hearing you emphasize though, and I like your framing on a lot of your words, by the way. I love how you're presenting this stuff, because there's so many little triggers and potential bombs in here where people talk about biases and things. But the way you continually frame this is, you want these interviews or these professional interactions to be focused on you as the individual.
Yes. And I don't want to be distracted.
You don't want to be distracted by, so it could be your style, it could be who you are, it could be a piece of you. But what I'm hearing you say is, particularly in a medical student interview, you want them to figure out what's inside of you. And if the external side is so distracting, you may never got a chance to actually reveal how great a resident you are or whatever. And I just really appreciate you being very cognizant and specific about how you do this, because there's people could really say that there's some inherent bias in here, there's some racial inequity issues, there's some socioeconomic issues and things. But you're, at least with this importance with this book, is you're establishing a framework to provide people those insider sort of tips, so that we're kind of leveling and neutralizing that playing field so that people can focus on the individual. And I just have to say, awesome job there.
Thank you. Yeah, I'm going to piggyback on that and say a couple things. There's this Italian term called Sprezzatura, and it means, like, if, it gives you basically an opportunity where if everything you're wearing, the whole way you present yourself, demeanor, everything is perfect, you can play around and have fun with one element in your style that can kind of distinguish you. It might be a pin. Like, for people in the LGBTQ community, it might be a rainbow flag. For somebody who's dealt with domestic abuse and violence, it might be a pin to signify that. It might be a fun pair of socks. It might be a really wacky pocket square. It might be a ring or a watch or something that's fun and playful in your style. And that's okay, because that can be a conversation point. That can be something that allows you to enter in a conversation with a patient. And we can do this in interviews in medical school, and we can also do this in terms of relating to our patients. So, maybe if you take care of a population where autism is a big deal, and you wear like the colored puzzle piece that represents autism, and that might be a great conversation point where somebody can see that and identify you as a person who can help them guide through that conversation. So that's kind of like this idea of Sprezzatura that I wanted to interject here.
I was going to ask you, Sprezzatura.
Yeah, Sprezzatura.
I
just love that
love
word.
that.
I love that it's a thing. I learned a lot about this because my friend started a suit company. I started learning about all these Italian fabrics, and I stumbled upon Pitti Uomo, which is this gathering of people in Italy around style and fashion. And I learned a bit about this, and it's just kind of a fun thing and enjoyable to learn about. I forgot the second part of this, but if you have any other. Oh, yeah. The second part of this was at the end of the book, I kind of close it with a manifesto. And I say, if dressing your best makes you stand taller, makes you speak more clearly, if it helps you relate to your patients, if it makes you feel better about yourself and the work that you do, then do it. If you're going to be hung up on every little detail about getting your clothes dirty and it's going to distract you from patient care, and if it's going to be a burden for you to do the dry cleaning and all this, and it's going to be a barrier between you and your patients, don't do it. Okay. So that's kind of like the way I close it. This is an opportunity for you to, when you go into a med school interview, really look and feel your best. When you're practicing medicine, look and feel your best so that you can uplift this doctor-patient relationship. And if dressing well makes you feel like that, do it. I'm so happy for you. If not, you can set this book to the side and forget about it.
But if you have to get through the interview, for a medical student particularly, set it aside after you get your interview done and get into school. That's like the key.
Well, and I think it's really important in the younger generation, in the world of social media, some of them may not have the awareness to appreciate the psychology, I know that they can tell that, how you portray yourself, that there's some element that they probably get, and they might be very astute on this, but there's such a psychology of the biases and these various different types of impressions that we may not cognitively understand. And I think sometimes just bringing that awareness to a younger generation that maybe hasn't worked on their personal development as much or is not as comfortable in social interactions, I think this guidance, I think, is really helpful. And they may not be able to implement all of it right at first, but I think those little elements over time they can layer in. I think it's very valuable for sometimes if you just live in a social media world and you don't really dive deep to understand the psychology. It's not just about you being you, but you realize it's not what you think you are perceived, it's what people perceive you as. So I think it's important to bring the conversation up. So I'm glad you did that. Yeah,
to add another layer to that, you're probably going from a college campus as a pre-med to a really traditional environment run by older people who are physicians who've probably, if you're interviewing at this stage, you likely were one of the first female doctors and, one of the few female physicians in your class. Now it's greater than 50% female. If you might have an older physician who's much more traditional. And so just having that understanding that you're walking into an environment where people take their craft really seriously, and you need to dress to reflect that you respect what they've done to earn their professional degrees and hold the standing that they hold. You're walking into a very traditional environment. And so I think medical students need to understand that.
Most definitely.
Pre-meds.
So Paul, how much experience did you have with suits prior to medical school?
None. I mean, I really wore an ill-fitting suit to my medical school interview. I got in, which was great. But my friend started a suit company in my third year of medical school. And as a gift for myself, I bought myself a custom suit. It wasn't that much more expensive than buying an off the rack suit. But I wore it to every single interview, and I felt very confident, and I felt like myself. I felt like the clothing reflected who I wanted to be as an emerging professional. And I will say that other professions, lawyers, business people, they get training on what to wear in the courtroom and what to wear in the boardroom to make a favorable impression on a jury or on a potential business partner that can make or break their case or their career. And we don't get that same kind of training. So I kind of wanted to bestow some of that knowledge on, what is a custom suit? What's a bespoke suit? How can you buy a suit at a thrift store and turn it into something that's just as good by visiting your local tailor, right? So it's most often about the fit, not about the price point. And so that's something I wanted to convey in this as well.
And I wanted to pull that out because I'm still not a big suit person. And in the times that I've had to do it, it is, I had totally blocked it out until you started talking about all the little tailor tags and stuff. It is confusing as all get out. So now I'm like, maybe I need to buy this book for my son who is in college. And I don't think he's planning on going into medicine, simply so he can see this stuff about suits and what you need to do, because I'm not going to be able to teach him.
Yeah. Oh, and of course, I'm the female on this right now. And it's always interesting because I feel like how we entered the profession and how we have these suits that, a lot of professions actually that were predominantly just males. It's weird, the transition between, okay, pantsuit, skirt suit, heels, no heels, closed toe. I'm sure there's somebody out there that probably podcasts this for the females, but
that's a huge thing. I do touch on that. I'm not the best person to speak on that. I'll admit that. But there are some double standards. A lot of times women feel pressured to wear high heels so that they can look taller and more confident. But at the same time, the second part of your interview day is typically walking around a large medical campus on a tour, especially if you're applying to residency. And so there's a pro and con. Maybe you wear high heels to the interview and then change into flats so that you can enjoy this walking tour. There's some pragmatism here as well. But yeah, that's a double standard. And again, I'm not the best person to speak on this.
Sure.
But something I do touch on in the book briefly.
It's challenging. Yeah. Go ahead, Kevin.
Yeah, I have two other questions for you. The one is on the chapter 4, because I'm looking at your table of contents, the doctor's bag. We haven't touched on anything on the doctor's bag. And I'm like, and I actually have like an antique doctor's bag, never used it. But what are you discussing there about the doctor's bag?
Yeah, I make house calls in my practice, and I feel like it's lost art. This is something that we routinely did as family physicians, 1920s, 1930s, 1940s. The majority of our appointments were house calls. The image that a lot of people have is of Marcus Welby, right? Now it's 0.1% of family physician visits are house calls. And so I kind of lament that, because I think making a house call is so powerful in creating a relationship with a patient, understanding where they're coming from, helping people in your community who are shut in and not able to come to the doctor's office. I will admit I have the luxury of being a direct primary care physician where I have extra time built in my schedule where I can make these house calls and charge people, $100 to do it. And I have people in our community that need this sort of service who are willing to pay that. And so I'm grateful to be able to do that. But I do talk about, what I bring in my doctor's bag. I review the patient's vaccine status beforehand. I give them a call. I ask them, hey, can I bring out this Tdap? It looks like you haven't had it in a while. I bring blood draw supplies. We do lab work. We bring it back to the office, spin it down, send it out to Quest. I talk about, the look and feel of a doctor's bag. Again, you're giving yourself the opportunity to be a trusted professional. You're walking into somebody's home, so you want to look the part, and so that they are going to trust you easily and develop that relationship with you. And a lot of times, the person is going to be unable to leave their house, so they might be bedbound. So oftentimes you'll meet a family member or a caretaker, sometimes multiple generations of the family who are caring for this individual. And so I talk about a lot of that in the book, and I think it's important to at least know what could be in a doctor's bag. The doctors who really carry it around the hospital are the neurologists, right? They got the bag of tricks, the tuning forks, the foot prick, the cotton swab, the coffee grounds, all that kind of stuff to check the cranial nerves, et cetera.
It made me totally think about it, because when I was shadowing the doctor I shadowed before I went to medical school, in the hospital, and we must have only had one neurologist in the town at the time, because he was like everywhere, and he had this black doctor's bag. And it's very much a fixture in my mind of this black doctor's bag. And so the first time when I read this chapter here, it said the doctor's bag, that's the first thing I thought of with this person was that actual doctor's bag. So very cool that you're bringing that back.
Yeah, it's a symbol of the profession. I think that it's kind of a lost symbol of the profession. It's almost like a vestigial trait. But I think it's something that's kind of cool that, you can incorporate in your wardrobe, walk into the hospital. Be thoughtful about the materials that you have. For a college kid, it's cool to have a backpack. For a medical student, you might want to upgrade to like a leather briefcase, something that's going to look like you're a professional or professional student. Likewise, when you're walking to the hospital, bringing a leather bag with all your belongings in it is going to look a little bit better than, a grocery bag or a backpack or some of the other things that I've seen while, rotating. There are good ways to wear a backpack, and then there's not so good ways. I had a mentor who made house calls at the assisted living facility, and this very nice black metallic Victorinox, like Swiss Army sort of backpack. Kept all his charts, his computer, his things that he needed to do his work, and it looked very professional. At the same time, if you're wearing like a North Face backpack, maybe not the best look, especially if it's like, camo or something like that. Who knows?
Awesome.
One last question.
Ahead,
this
Kevin.
has been bugging me since you said it, and I hope you remember this, but how do you hold a water bottle? I was like, well, how are you supposed to hold the water bottle? I mean, but I just screw that up in my interviews.
Yeah, you don't. The idea is that you have your hands free to shake hands with the doctor that you're meeting with.
Okay.
And so you're going to get cookies, you're going to get sandwiches, you're going to get snacks, you're going to get waters. Have a sip of water, have a bite of a sandwich. Do whatever. When you're done with it, set it to the side. Don't carry the water bottle to every interview, because then you're going to have your bag in one hand and your water bottle in the other, and then you're going to go, oh, let me shake your hand, and you're going to be like, oh, what do I do here? The idea is that you don't carry around the water bottle for the rest of the day.
Okay.
If you have a spot in your bag for it, great, set it in your bag. And likewise, if you want to sit down and take a notepad out of your briefcase and take some notes, that's a good look. I have a couple questions here. I wanted to write them down so I didn't forget. That's a good look as well. It shows that you're prepared. Again, mature and confident.
Nice. I love it. Kevin, any other curious questions?
Well, I got a ton of other curious things, and it's just fascinating to me. And I have to say, Paul, thank you for coming on, because these are my favorite type of discussions, is something that you think is so like, well, why do we even need to talk about this? Yet we obviously need to talk about this, because there are so many nuances here that are so important to our profession, to your personal career, to whether you're applying to medical school. So thank you for coming on, and thank you for writing this book. Yeah, this has been a lot of fun, and I've learned a lot.
You're welcome. It's a sincere pleasure. Thank you for helping me bring this out to the world. I do appreciate it sincerely.
Absolutely. Well, tell us where they can find out where this book is or learn more about you.
Sure. My name is Dr. Paul Thomas. I started a practice called Plum Health in Detroit. We're a direct primary care practice. I wrote this book. It's called Dressing Well in Medicine, and it's available on Amazon. For right now, that's the only place you can find it. If you don't have an account and you want to get a copy, send me an email, paul@plumhealthdpc.com, and I'll send you a copy. And
awesome.
That's it.
Thank you. Well, thank you for informing us how to take action on fashion for the benefit of the medical community. And hopefully we'll get to talk to you again in the future. And for those of you out there that don't know what the Change Physician is all about, please go to thechangephysician.com and join us there in the community and get to hear wonderful interviews like with Paul Thomas today. And we look forward to seeing you on the next episode. Take care.
Stay well, folks.